People are taking stronger and stronger opioids. They're becoming addicted more quickly. The stronger the opioid and the longer they take it, the more likely they are to become addicted. And this addiction leads to tolerance. It leads to a need to take more opioid to get the same effect. And that's how people overdose.
5 years ago, researchers at Seattle-based Kineta Biotech recognized the growing problem of opioid overdose and abuse and began working to create something completely different.
One of the reasons that we selected to work on this drug is because the drug doesn't enter the brain or spinal cord, the central nervous system, and the target of the drug, the thing that it interacts with in the body, is actually not expressed in the brain or spinal cord. One of the reasons that we focused on this particular drug mechanism and this drug is because it doesn't have any effect in the central nervous system.
Kineta CEO Sean Idonato says opioids act on the brain and spinal cord, masking the pain. He says their drug, called KCP-400, focuses on the source of the pain.
This drug is really designed to only work at the site of nerve injury, wherever you might have an injury, whether it be chronic lower back pain or an injury in your arm or legs. The drug blocks pain signaling at the site of injury. It doesn't work in the brain and spinal cord, and that's what really differentiates it from opioids.
Another way KCP-400 differs from opioids is the side effects. Opioids reduce cognitive ability, motor function, and most importantly, slows respiration. So if someone accidentally takes too much, they just stop breathing.
So far in animal studies and animal toxicology studies, we don't see any of those typical effects on coordination, gait, balance. We don't see any lethargy or sleepiness. So those are, so far, indicate that the drug is not going to have any of those traditional opioid-like effects.
KCP-400 was created with the help of a sea creature. It's derived from a protein found in the venom of a cone snail. But patients won't be taking venom. They've developed a fully synthetic version. And on top of pain management, it also creates an anti-inflammatory effect.
One of the ways that an acute injury can turn into chronic pain is that the acute injury can lead to inflammation of the nerve. Inflammation of the nerve can lead to neurodegeneration. And so even though the primary injury can be corrected by surgery or just generally through healing, those people can develop a chronic pain syndrome through ongoing inflammation and ongoing neurodegeneration of the injured nerve.
Testing on KCP-400 is still in its early stages, with human clinical trials expected to begin next year. Meantime, Kineta's scientists continue to work on the drug they believe will change lives for the better.
People who are in chronic pain spend a lot of time managing their pain, so they have less time for doing normal things like going to work, living their lives, spending time with their families.
About the food.
At this point, their plan is to use an injectable form of the drug weekly, some patients being trained to give themselves the shot, much like insulin. They're also working on a second generation of the drug that would be given once a month. For HealthLink, I'm Amity Addrisi.